We all want the same things. Safe surgery, good outcomes for our patients, and yes, efficient lists. But we also collectively have an obligation to train the surgeons of the future, and balancing all those things is not easy. My name's Poppy Redman, I'm a Gen Surg trainee in New Zealand. I've got a Master's in Medical Education and I developed the Surgical Education Checklist. It's a simple tool to help make training in theatre efficient, effective, and hopefully not forgotten. The way to get the most out of the checklist and the learning opportunities available in theatre is to focus on a trainee's growth zone. This is outside of their comfort zone, beyond what they can do independently. There's not that much learning there. But it's also before the panic zone, which is outside of their capabilities and would just be setting them up for failure. Break up operations into their key component steps and assign the steps with the most relevance to the trainee's growth zone. That way you can keep the list efficient whilst not losing out on key learning opportunities. Before the start of every list, there should be an educational briefing. Who's coming to the list and what's their experience level? Where's their growth zone at? And then decide who's doing which steps of which cases. Share your plan with the whole theatre team so that everybody knows that training's happening. And it's not an apology, it's an expectation. Before the start of every case, make sure you're still all on the same page. Catch up whilst you're scrubbing. Who's doing what bits might be tricky, how are you going to manage that? How helpful and present is the boss going to be? What might it look like if and when they have to take over? During the case, remember that everybody's cognitive load is high, so keep feedback specific. If the trainee is struggling, pause and question. If you can, let them struggle safely, because that's where most learning happens. And after every case, catch up just for a minute and give some specific feedback to that case. Even if you feel like you just said the same thing 10 minutes ago, say it again, because recapping after the case helps to consolidate. At the end of the day, get together and debrief. Ask the trainee if there's anything specific that they want feedback on. And then recap on the day's learning and turn those learning points into concrete action plans and goals for the future. For the Surgical Education Checklist to work well, both the trainee and the trainer need to be engaged. The trainee should be coming to the list prepared, knowing what their goals for the day are, and they should ask for feedback. The trainer should invite the trainee to share those goals, and they should be forthcoming with feedback, both positive and constructive. Remember that the checklist is flexible. It's great if you can do the whole thing at elective lists, but for acute cases or one-off cases, just do the timeout and the sign-out. The Surgical Education Checklist is not about adding more work to your already busy day. It's about making best practice routine, so that training in theatre is deliberate, structured, and effective. I'd love to hear your thoughts on the checklist, so please do get in touch.